Joining us to talk about this and more COVID news in our state and community, Singing River Health System's emergency room physician, Dr. Greg Patino. Dr. Patino, thank you so much for joining us.
Happy to be here.
Yeah, the hospitalizations, statewide at least, are becoming a bigger issue now, with cases doubling or almost doubling just in the past 20 days. A lot of the hospitals, especially in the Jackson area, have no ICU beds. What are your concerns about this statewide problem, and how is it affecting us here, and what's the situation right now at Singing River?
No, that's a great question. The biggest impact of having those tertiary hospitals so full is sometimes it's difficult to transfer patients out that may need specialized care from facilities such as ours. So that's kind of the biggest issue we've been running into, is having some problems with transfers of higher acuity individuals that need specialized care just because those hospitals are full.
And what are you seeing right now at Singing River in terms of COVID patients that are in the hospital, and just as far as ICU numbers and all of that?
Right. We have, I believe, a total of 29 that currently are admitted to the hospital. Of those, I believe we have 14 in the ICU. 7 of those, I believe, are on ventilators, and then we have another 15 or so that are on the floors right now.
Yeah, so it is, the number is growing at your hospital as well then.
Right. We have been seeing increasing hospitalizations, which is kind of what we expected. We knew once we started to see an increase in numbers, eventually there'd be at least some increase in hospitalizations.
Yeah, I know 10 more counties were added to the mask mandate yesterday, making it 23 now, I think, in Mississippi. That order coming from the governor yesterday. One thing he said, assume everyone has it. If everyone would do that and practice the social distancing, wear their masks and all of that, with pretend everyone around you has it, then that would stop the transmission, basically.
Yeah, that's perfect advice. I don't think I could say it any better. Everybody needs to pretend as if they themselves have it and the people around them have it. And if we kind of take those precautions, then we'll definitely decrease the spread.
And he also said that it's probably going to take about 3 weeks to see a difference in numbers if the mask mandate does what it's supposed to do and people are following these guidelines. So would you say that's about right? I think he also said we're paying right now for what happened July 4th weekend, which was about 3 weeks ago.
Right. We had so many people out and about. I think that's probably correct, because, it's super hard to predict completely, but you'd expect with people sometimes lagging symptoms for about 2 weeks or so that you'd be seeing an increased number of cases out through that point.
How are you feeling about things? I mean, as a doctor who's dealing with this on a daily basis and living in the community, seeing what's happening around the country and the growing numbers, of course, school's about to start. What's your gut feeling right now?
Right. I'll say, as I've always said, I'm still optimistic, right? I believe that if we continue to take some steps, be more cautious, if everybody gets on board, that we're going to be okay. It's a time game, and we just have to try to preserve resources and keep people safe as some of the other more advanced ways to combat COVID come into line, such as vaccines. So, I'm optimistic. I think we're taking some steps in the right direction. If we continue to do so, we should start seeing improvement.
All right, Dr. Greg Patino from Singing River, thank you so much for joining us today.
My pleasure. Thank you.